Should you try to treat the pain from your herniated disc at home with time, medicine, and exercise? Or is it time to try surgery? To make this decision, you'll want to follow 3 steps. First, learn the pros and cons of having this surgery. Then, take the time to think about your personal feelings and what's most important to you. And finally, talk all of this over with your doctor. Okay, let's look at the pros and cons first. On the plus side, surgery may relieve your pain sooner, but it doesn't always work. And a year later, most people who have surgery are no better off than people who chose not to have it. Here are some numbers that will help explain. Take 2 groups of 100 people who have leg pain caused by herniated disc. If one group has the most common type of back surgery, 3 months later, 50 to 60 of them will be pain-free, or almost pain-free. Now, if Group 2 chooses non-surgical treatments, like medicine and exercise, 3 months later, 20 to 30 of them will be pain-free, or nearly pain-free. After 1 year, 90 to 95 people in Group 1, the surgery group, will be pain-free, or almost pain-free. And in Group 2, those who did not have surgery, 80 to 95 will be pain-free, or nearly pain-free. And 4 years later, there is no difference between the 2 groups. For the 100 who chose surgery, 10 may need it again within 4 years. And for the 100 who chose non-surgical treatment, 10 may need surgery within 4 years. Now, back surgery has some risks. Besides possible problems from anesthesia or infection, there's a slight risk that surgery could actually damage your back. Here are some more numbers to help explain. The most common type of surgery is microdiscectomy. If 1,000 people have this surgery, up to 3 of them will have permanent nerve damage as a result. As with most surgeries, there's also a very slight risk of death. 1 or 2 out of every 1,000 people who have microdiscectomy will die from problems related to the surgery. Now, your personal feelings are just as important as those medical facts. So think about what matters most to you in this decision. For example, here are some personal reasons you might have for having surgery. You feel comfortable with the idea of surgery. You've tried other treatment for a while, and it hasn't helped. You're in so much pain that it's hard to live with it. You want to get your pain under control as soon as possible so you can go back to work. And now, here are some personal reasons you might have for not having surgery. You don't like the idea of surgery at all. You think other treatment is starting to help. Your pain isn't bad enough to think about surgery right now. Time is not a problem, and getting better slowly with treatment other than surgery is okay with you. Okay, once you've thought about the pros and cons and your feelings, then it's time to think about your next step. You might want to talk it over with family members or friends. You may want to find out how others in your situation have made their decision. Maybe you want to do more research about the pros and cons. Once you feel like you have all the information you need, talk about your decision with your doctor. Together, you'll figure out which choice is right for you.